Hello and welcome back. My name is Lisa Abraham. I'm a registered cardiac sonographer. This is the second part to our three-part series. And if you watched our first part, you know who this beautiful lady is, Joanne Hall. She has been speaking to us about ergonomics. She is a peer-reviewed author. She started a company called UltraSafe Ultrasound, and she has pioneered in the realm of ergonomics and soft tissue recovery. And these are all things that we as sonographers need to know and understand. It's important information because this affects our day-to-day life. And so I wanted to welcome you, Joanna Hall, to this second part of the series. So yeah, introduce yourself and let's get started.
Thank you, Lisa. I appreciate you having me back. This is such a tremendous and empowering series for every viewer that gets to be impacted by it. So we're so happy to be able to join you in continuing to increase awareness and advocacy for safety in sonography. I am an abdominal sonographer, OBGYN, and vascular. I'm sure that our viewers know, and for the students who are learning, there's some differentiation there between the specialties and how ergonomics and biomechanics can affect you and your body depending on your specialty. So we're so happy to be here to be able to spill all the tea in sonography on how to stay safe.
Yes, I love that because like you said in our last interview, this affects over 90% of the workers in this field. I mean, that's literally everybody, right? And so we touched on a few things on our last session. And so this part I wanted to get into, why does this matter to sonographers? Why should we know and have, at least in our vocabulary, what muscles affect us and what ergonomics and biomechanics really are?
I love that question. Thank you for asking. I would say knowledge is power.
Yeah.
And right now, there's only so many things that a sonographer has control over in their workplace, in their workspace, in their workload. And so you have to be able to take that control back. And the way to do that is through knowledge, is through education, is through empowerment. And so it's extraordinarily important for us to know what our bodies are going through as we are performing diagnostic ultrasound, because you don't know what you don't know. And you don't want to find out when you are now in a defensive realm of STR and trying to rehab yourself. And you're like, what happened? I'm in my 20s. I'm in my 30s. Like, why do I feel like I'm 60 years old? Why does my body hurt so much? And what can I do to get back to a place where I wasn't living in chronic pain and where I can still participate in healthcare and be a healthcare provider and not become the patient?
Exactly. That's where I feel like I am. I feel like I'm 85 years old right now because of all the stress that I've put my body in. So that's why this topic is very near and dear to my heart as a cardiac sonographer. I know you mentioned you're not cardiac, but we all do the same thing in various ways, but we are still using our bodies pretty much the same way, And so with that being said, I know we were talking about, I had asked you, or I'm going to ask you, are sonographers among healthcare workers that are the most prone to injury? What do you think about that?
Well, I would say injury is multifaceted, right? Because of what our bodies are being put through symptomatically, that's where we're trying to heal. But this journey in safety, this journey in healthcare, which has become much more prevalent in the past couple of years, it's mental, it's spiritual, it's
Right.
emotional. And so what our bodies are going through, our minds are going through as
Right.
well. Our emotional states are being impacted. So when it comes to the most prone for injury, it's hard to hone in because injury is really mind, body, and spirit. And I would say that nurses have amazing representation for the injuries that they endure, mind, body, and spirit. If you look at the Occupational Safety and Health Administration's website, you know, those who are right up there at the most at risk for MSDs, which are musculoskeletal disorders, are nurses, you know, but and I'm now a stakeholder in OSHA, and they have since updated their sonography e-tools since I went banging down their door. So I'm very grateful for that.
Thank you.
Oh, my pleasure. They heard my voice. I said, listen, it's not gonna do.
We're out here too, you know.
We're out here, and it's hard in these sonography streets, okay? And I would say sonographers are, just based on the stats, it's obvious that we are at an increased risk of exposure and injury secondary to scanning. You think about that 90%, that's, you know, folks who are just starting to feel symptomatic, folks who are, you know, a little further along and they're like, this is starting to affect my job and my life. And then there's another level where they're like, what do? I don't even recognize my life anymore. So I would say when you think about healthcare providers and what we've all endured in the past 2 years, especially, that we've all been prone to injury one way or another, and our families have had to endure that right along with us. But when it comes to physical manifestations of our injuries leading to trauma, nurses are right up there and have phenomenal representations and unions and everything that speak to that information. And sonographers are also right up there with not nearly as much representation or awareness, but we here to fix that.
Exactly. That's exactly right. You know, my aunt is a respiratory therapist, and she recently had rotator cuff surgery. And I've been, you know, calling her and seeing how she's doing. And she told me, she was like, Lisa, I wouldn't wish this on my worst enemy. This is the worst experience she's ever been on and been through. And she told me, Lisa, make sure you take care of yourself because she's out for 6 months. And her recovery is actually not going as planned. So it's taking her longer, right? She can't do simple things like put on a shirt or comb her hair or lift her arm up for reaching to go get salt and pepper. You know what I mean? In your cupboards. And so those things affect, we get affected by what we do. Yeah. And we need to know how to take care of ourselves because, like you said, you know, I know nurses get, and we love our nurses, but they get the most attention. But we are out here, other healthcare workers are out here feeling the pain. And so that's why I want to bring this to the forefront. So with that being said, what are the causes of work-related muscular skeletal disorders, or RWMSD is what the acronym is, but what are the main causes of that? Can you tell us that?
So when we think about work-related musculoskeletal injuries or disorders or WRMSDs, we have to again kind of think on that multifaceted level. Like your friend had said, like you wouldn't wish this on your worst enemy. When you lose function of an extremity, you cannot count the ways how your life will be altered. You know, being able to, you know, reach behind you and unstrap your bra. I mean, those are everyday things. Brushing your hair, brushing your teeth, being able to abduct your arm to clean your hair, lifting a gallon of milk out of the fridge, driving. I mean, when you lose that full function, it is truly a life-altering experience. And work-related musculoskeletal disorders, or even just musculoskeletal disorders in general, are one of the most common ways to decrease the quality of life of any person that suffers them. Now, when you're suffering them secondary to what you do at work, that just adds insult to injury, especially if you don't have the support behind you and the resources in front of you to tackle that head on. So now you're not only injured, but you are confused and looking for help and looking for resources. And so that just adds to that mind, body, and spirit injury. But I would say the main causes is go, 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 go. Healthcare providers, we are inherently trained to save the other person. We are inherently trained to save a life, to provide patient care. And that's what we're trained to do. And we do it very well. We want for that patient who's coming to us, who's scared, who doesn't know what's going on. We want to find that answer for them, or at least rule something else out. We want our doctors to see us as valuable members of the healthcare team, whether that's in an acute care setting or in a private practice or a freestanding ER, you know, wherever you're serving, you want to be valuable, not just for the patients, but for the providers. And so it's very easy to go.
Exactly.
It takes a lot of energy and mindfulness to step back, slow down, and take care of yourself first. How are you starting your day? Are you starting it, the alarm goes off and you're like, oh,
exactly.
Or are you starting it with, I'm so glad that I heard that alarm go off. You know, let me be a blessing to whoever it is that's going to be under my transducer today, and let my body be able to sustain it so I can do it again the next day and the next day. But when we wake up and we're already defeated and we're already tired and we're already preparing for all of the things that we're going to have to navigate, and we haven't even gotten to work yet, you're already setting yourself up for a negative cycle that's going to perpetuate. So the main causes is go, 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 without taking a step back to take care of ourselves. But then when our body is telling us something, Lord have mercy, we have to listen.
Yes, exactly. Exactly. And that goes back to, yes, slowing down. And I know everybody's hospitals or clinics, everybody's environment is different, but just taking an extra 5 or 7 minutes just to hey, I'm just going to step over to the side right here real quick and take some breathing, breathe in and out a couple of times and just stretch your body. And that's so important to how we incorporate biomechanics and ergonomics, I believe, you know?
Absolutely.
And so with that being said, how do we keep ergonomics at the forefront of a sonographer's workday?
I love that. Well, first of all, when people think ergonomics, they always think like move the patient closer to you all the way to this side of the bed. And those are really great things to consider and be mindful of. But ergonomics is so much more than that. It's your environment, right? It's, do you have access to natural light during your day? What are you putting inside of your body? Are you staying hydrated? Is your soft tissue infused with hydration and water so that it's malleable, or is it dehydrated and like stiff, and now you're over here applying downward pressure and your muscles start, you know, weeping metabolic waste, and so then your biochemical components start symptomatically speaking to you, and it may not necessarily be that there's anything wrong. It could be that you just have toxicity sitting in your muscle group. Go walk it out, stretch it out. What are you doing between your patients? Do you have the death grip while you have your patient, or are you holding the transducer and allowing your smaller flexors and extensors in your forearm to be able to receive oxygenation and actually maintain that static posture? What you're doing between patients is very important. Are you grabbing your phone and scrolling and now causing your thumb, you know, even more symptoms? Or are you doing neck rolls? You know, are you doing squats? You know, you'll see Joanna squatting right down the hallway and I don't even care. Why? Because it makes me look amazing. And a lot of our upper body strength is going to come from our lower extremities. So
Right.
we really want to be mindful that that strength we have up here, we can optimize up here by also strengthening our lower extremities as well.
Right.
So kind of being mindful of the whole machine here, what's inside of it, and what we can do to make sure that whether we're bedside and we're in that go 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 mentality, because it's always more patients, hurry up, there's another one, the add-on came, now the one who didn't show up now showed up, so now you double booked, and then the ER just went off, and there's 3 stats, and LND is calling because the baby is breaching. You're like, oh my Jesus. Breathe, like you said. Breathe. It takes 2 breaths, Lisa, 2 deep breaths to change from operating in a sympathetic nervous space where you are in fight or flight to operating in a parasympathetic nervous space where you in rest and digest. And that's where that critical thinking really comes in and best performs. So we have to slow down, and even 2 breaths, whether you're STRing or not physically, those 2 breaths are going to reset your nervous system. So everything matters.
So do you have a quick, like, as far as how should we hold the transducer? And when we are looking at the screen, how far up or down should we be, I guess, extending our neck, looking at the screen, like, do you have a quick way of thinking when I'm sitting, when I can sit down and I'm setting up my machine and my patient, is there a quick way we can just be like, just check what we are doing to make sure we're ergonomically correct?
Absolutely. I would say there's 3 really quick and easy things that you can do. First of all, you let your patient do as much of the work as they can. Okay. If they're able to move, I know we want to be accommodating as healthcare providers, and we'll reach because it's just that one patient, it's just that one organ, it's just that one exam every day for years, is just that one. Make sure that your patients, if they are able-bodied, that they do their part. Don't be shy, and don't think that you're not doing the best job as a healthcare provider because you're making your patient move. If they want to, they'll move. Okay.
Exactly.
The next thing I would say is the easiest thing that you can do is make sure that your screen is level. It should be just eye shot right here. You shouldn't be looking up. You shouldn't be looking down. You shouldn't be like this or diverted the other way. Is that always possible? No, we know as well as anybody else as healthcare, and that's not always possible. But for the majority of the time, when you can, slow yourself down and adjust that screen so you're looking as dead on as possible. And then the third thing I would say that is the easiest and most important thing to do, and I just mentioned this before, is watch your death grip on the transducer. We tense up our all of our hand muscles, all of our forearm muscles, and that squeezes the brachial plexus that's coming from your cervical spine down your shoulder. And so we want to be able to have a nice firm grip. We want control of our transducer because it's going everywhere our arm is telling it to go. But we tend to just grab it and just ease up. And you might have to mindfully think of that. Ease up on that grip. Make sure you can actually see your screen with as little twisting or deviation from center as possible. And don't be scared to tell your patients, move. Thank you.
With the please and thank
professional way, of course.
Exactly. Yes. Thank you. Yes. I completely agree. If I can have my patients do a lot of the work where they can move and they're mobile, I absolutely take on that mindset of having them help me, right? And a lot of patients are willing, and they're more than happy, right? They want to be treated, they want to be helped, and they're more than happy to help you out in any way you can.
I would say one more point, like one of the biggest things that sonographers, they'll hurt themselves over because they don't want to be like, they don't want to insult the patient, is when you have an obese patient and their pannus is super duper low or heavy. And you have the sonographer trying to like hold up the panic and then
Yeah,
get the transducer under there, and they're like, wait, I don't have any arms left for my machine. So then they let the
exactly.
panic go, it drops on the transducer and their arm, and now they're trying to work the machine.
Right, right.
Tell your patient to hold it up.
Exactly.
You just have to do it. They didn't
Have to.
listen. If they took a shower, they understand that they had to move some stuff. And if they didn't,
Right,
well, guess what? You're probably going to
right.
smell it when you lift up that penis. They know the body habitus that they came in with.
Right,
Your job is, of course, we want to make sure that we are sensitive to all of
right,
our patients and to anyone
right,
that we have the privilege of taking care of. But
right,
don't let your thoughts on embarrassing the patient or insulting the patient
right.
cost you your
Exactly.
safety, because now you're just trying to be as accommodating as possible.
Right. And
That's
then
what
you're
we want
hurting
to do as
yourself.
health providers, but you're just going to
Yeah.
hurt yourself.
You're hurting yourself, you know, and I do take the time to try and adjust the bed. I adjust the patient. I make sure I have maybe towels that I can put underneath my arm. I'm doing a lot more things to really help myself not get injured more than I already am, you know? And so I'm noticing, I'm being very mindful of how I'm taking care of my patient, but I'm also taking care of myself. So as a cardiac sonographer, we have the patient always lay on their left if they're able to. Sometimes, you know, in ICU or these very difficult patients, you have to kind of push in, or you have to exert force on your body, and that's just what it is. But if you're in that case, I would say after you're done with that patient, definitely take a break and do some stretches and some exercises that are going to help you get some blood flow to that area. Because I used to not, I would just keep going. I had a really hard, if I had a hard patient, okay, got them done, next patient, you know, and I think years of doing that, I've definitely caused injury on my body. But now I'm trying to fight back, you know, and not fight back, but just, you know, fight back my body, help my body, you know,
Yeah.
heal and get back to what where I can actually work properly, you know.
And typically
Um,
the way it goes is once we become
yeah,
symptomatic, that's when we're like, oh my gosh, I
yeah,
need to
ding, ding, ding,
adjust.
ding. Yeah,
And
exactly.
that's why getting this information to students is so important, and to other
Yeah,
sonographers is so important, because
yeah,
you don't want to wait until you have
you
to
don't.
readjust your life or your
Right.
lifestyle or your scanning style. And you don't, this is how you've been scanning for 5 years. And now you're
Yeah,
like, how do I adjust? If we create
right.
good cognitive dynamic behavior from the beginning, it's going
Right.
to be much easier, to keep that behavior through. And it's going to be the best when you are in the knobology phase of
Yes.
learning ultrasounds.
Yes, exactly. Well, thank you so much, Joanna. This is the end of our second part of our series. And thank you so much for all the wonderful information that you've given us. How can they reach you if they want to get a hold of you
Well, there's a
for
couple of
your
different
information?
ways you guys can join Safety and Sonography. We have, of course, our Facebook groups and all of our social platforms. There's Sonographers Spill the Tea. That's our free Facebook group where sonographers can come in and just spill all the tea in sonography and feel like they have a nice community and a safe space to be able to do that, where they don't feel like leadership or management is going to see their words as unvaluable. We also have the website where anyone can reach out to us for staffing for sonographers, safety certification for the
Yeah.
industry, or even speaking opportunities to be able to get one-on-one training. We have our learning platform where all of our courses are housed in ergomechanics, in soft tissue recovery versus scar tissue rehabilitation, or even if you just want to see some really great ergonomic behavior for different exams, all of those things are available to you at
Awesome.
teamsono.ultrasafeultrasounds.com.
Awesome. Well, thank you so much for your time and thank you for your information. And like I said, there's a 3-part series, so we will be seeing you again soon for our third part. Thank you so much. And I hope you have a great day. Thank
You're
you.
welcome. Can't wait. Bye, everybody.
Bye.